Welcome, everybody. This is my first time doing Facebook Live here, so hopefully all these technicalities will work out okay. We'll see how they go. But for those of you who don't know, my name is Dr. Stephen Lome, and I'm a cardiologist at Rush Copley Medical Center in Aurora, and I have a huge passion for lifestyle medicine, for plant-based nutrition, whole food plant-based nutrition to prevent and reverse heart disease and such. So really what I like to do with this whole Facebook Live thing is give a little presentation. I shared my screen. Hopefully everybody can see me, and hopefully everybody can see the presentation on the screen here. And what I really want to do is on a regular basis, hopefully every Monday, I'm on call sometimes, it might not be every Monday, but I'm going to try consistently every single Monday to do a Facebook Live, present a certain topic, and then do some question and answer afterwards. Because really, what we need to do for this whole plant-based nutrition movement is just get the word out, support people, not just the people who already follow plant-based diets to help get their questions answered, but to be active and bring other people into this way of eating in this lifestyle, because it's so powerful to help prevent chronic disease and heart disease and such. So, so that's kind of the background of why it is that I'm doing this, and my passion, and how I plan to do this in the future. And of course, disclaimer-wise, not giving medical advice, definitely through questions and answers. This is just general nutrition type of recommendations and thoughts about evidence-based nutrition for prevention and reversal of heart disease. So that's what we're doing today. And in the future, of course, we'll have other topics. However, anytime you want to make a major change to your own diet or your lifestyle, every person's medical situation is unique and different. So please make sure that you discuss with your own physician and do it that way. So again, bear with me with any of the technicalities or whatever with my first Facebook Live session here, but hopefully in the future we'll get this more streamlined so everybody can kind of join in and answer questions. So let's go through the presentation here on out, and I'll go through it. It'll be maybe 20 or 30 minutes or so. And again, I hope you guys can share your screen, can see my screen. Be sure if you have any questions, type them in the comment box, and then I'll be able to answer the questions, as many as I possibly can after the presentation is done. So, all right, here we go. So this was me just 4 years ago. I want to give you a little background behind why it is I'm so passionate about this. About 100 pounds heavier, I was well on my way to standard American diseases and the standard American death because I was following standard American diet. I had so many different obesity-related ailments. I knew personally I had to make a change with my own approach for myself. However, at the same time, I was getting frustrated as a clinician because I knew all the right pills to give my patients, pills and pills and pills. I was really good at that. I was trained in a huge Western medicine university program, and that's what we learned about. We learned pills and procedures, and it was getting frustrated because even if I gave my patient all the right pills, they might still have a heart attack. They might still have a stroke. It was not really the way I felt like I wanted to practice medicine. There was something missing. And so as I started learning about nutrition myself and lifestyle medicine, everything kind of came together. But I did make the same mistakes almost everybody makes. First, I thought that exercise was the key. So I went crazy exercising. And then I made the mistake of reading the USDA dietary guidelines for nutrition, thinking chicken and fish, low-fat dairy, and olive oil, thinking all those things were the right things for me to eat in order to be healthy long-term and lose weight. And I could do those unhealthy things, these unhealthy foods like I was doing before, in moderation. So, well, once a week, a sugary drink, once a month or so, you're having a burger or fast food, moderation, right? Big mistakes. Exercise isn't the key, nutrition is the key. Exercise is 20%. Eating clean is 80%, and moderation doesn't work. Bad things should be zero. You shouldn't smoke cigarettes in moderation or do heroin or cocaine in moderation. Bad things should be zero. So those are the mistakes that I made. And luckily, it all came together for me when Netflix randomly said, hey, you should watch this documentary called Forks Over Knives. Forks Over Knives. So I watched this documentary, Forks Over Knives, and I was blown away. I said, what? Heart disease is a toothless paper tiger need never exist. You can't reverse heart disease. This is bogus. I was never taught this stuff. And not eating meat, dairy is bad for you? Olive oil is bad for you? What? So it just kind of blew my mind away. And I did my own independent research and saw this was all real stuff. This was really legitimate stuff. There's good science to support this. So I ended up really becoming passionate. I changed my diet within 6 months and no change in my exercise routine. What happens? I lose 60 pounds in 6 months and reach my ideal body weight for the first time. So then I became super passionate about it. So that's my story and my background. So what I'd like to go through here today is I'd like to go through heart disease and how important it is. Look at this. Look at the perspective of heart disease. Heart and circulatory disorders just tower over every other cause of death. Look at this huge yellow circle. Cancer is big too, but look at these other things like suicide, murder, and war, very small compared to what most other disorders are. So it's really, heart disease is just so huge and it's so preventable that why isn't it that we're not doing more about this? You know, heart disease has been the #1 cause of death in America for almost 100 years in a row, towering over all these other causes of death. When you look at the numbers, here's another good perspective, that just about as many people died from heart disease in 2016 as the number of American soldiers that died in all wars in American history combined ever. That's crazy. Why isn't it that we're not doing more to prevent heart disease? It's nearly 100% preventable, according to good scientific evidence, and even reversible. I mean, come on, if some other country was killing 600,000 Americans every single year, we would go to war with them. Why is it that we don't do more to prevent heart disease? What's going on? I'll tell you why. There's 2 words that explains it all. Those 2 words is culture and money. The American culture is very not focused on eating healthy and exercising and lifestyle medicine type of topics. And honestly, there's just no money in healthy people. And there's right now is not as much money in healthy food, although hopefully that's changing. So if you really think about it, if you asked 100 years ago, let's design a healthcare system based on money, what would that look like? You know, we live in a capitalistic society, so there's no money in healthy people, right? But there's no money in dead people either. So what ends up naturally happening, and it's not like we want this to happen, healthcare systems don't want people to suffer or have chronic diseases, but they need to do what makes them money. That's just the reality of our system. And so the system ends up having people with multiple medicines, multiple diseases stuck in a nursing home. And that's just not the way that we want to be, right? They always say that our system is really good at adding years to your life, but we're not very good at adding life to your years. We really want a good quality of life up until the age of 90, be physically active, and then have a rapid decline in our health so that there's not this prolonged suffering, which ends up requiring lots of tests, surgeries, procedures, and medication. So it's just the reality of our healthcare system right now. So just the way that we think about nutrition, a lot of people already know this stuff pretty well. The way we think about nutrition is there's 3 food groups. Processed foods, that should be none, right? We should be eating none of that stuff. Zero, zippo. But processed foods includes the bad carbohydrates, the refined carbohydrates, white flour, white sugar, white rice. Those things should be zero, none. So really, we shouldn't have any of those in our diet. So, but what also blows me away when I learn more about this is we should consider oils in the processed food group. So processed foods, oils are highly processed, the most calorie-dense food in the entire human diet. Even though people think olive oil is healthy for you, it's not. It's still 15% saturated fat. So these processed foods should be zero in our diet. Then the other 2 categories that we have are animal-based foods and whole plant foods. And what we need to be focusing on is 100% of our calories from unprocessed whole plant foods, no oil. That's what we call a whole food, plant-based, no oil diet. So let's kind of talk about today's topic is talking about heart disease and how you could prevent and even reverse heart disease with a whole food plant-based diet. So the American Academy of Nutrition and Dietetics, people say, well, wait a second, 100% plant-based, well, what about your protein? What about nutrients? I thought you had to eat meat to be healthy, right? Well, no, look, the position of the American Academy of Nutrition and Dietetics, they state straight out that a 100% plant-based diet is nutritionally adequate and appropriate for all stages of life, all the way from pregnancy, infancy, childhood, adulthood, elderly people, and in athletes as well. So no, we don't need to eat animal products to live. So wait, we said zero processed foods, We don't need to eat animal-based foods to live, which is where all the cholesterol and saturated fat comes from, essentially, or 95% of saturated fat comes from animal-based foods. Then really, we need to be focusing on eating exclusively whole plant foods, right? So heart disease, the #1 killer in America, the #1 killer on the planet Earth, is reversible through a whole food, plant-based diet. I've been a cardiologist again for 10 years. I've been focusing on plant-based nutrition for about 2.5 or so now. I have never once ever in my career seen anything that could be as powerful for somebody's health and well-being as adopting a whole food, plant-based diet. It is extraordinarily powerful. It is the thing that we really need to do in our whole healthcare system to solve all of our major problems, eliminate chronic disease, and just completely get rid of heart disease. So let's go on a little bit about how exactly this works. So atherosclerosis, clogging of arteries, it actually begins in childhood. So the day you're born, your arteries are nice and clean. There's no damage to the lining of the artery right on the inside here, the lining we call the endothelium. We want to protect that endothelium at all costs, right? We don't want anything to damage that endothelium, because if it gets damaged and your blood cholesterol levels are high, guess what happens? You start building up as a kid, as young as the age of 3, and definitely even more in your teen years, cholesterol plaque in your arteries. So into adulthood, you get more and more cholesterol plaque that builds up, and then it becomes more advanced as you get older, into your 30s, 40s, and 50s. You clog more, you clog more, you clog more, until suddenly one of those plaques can suddenly form a blood clot right in the middle and 100% block the blood flow to an artery. And that's what a heart attack is. So in order to have a heart attack, you need to have already built the foundation for clogging of the arteries, for cholesterol clogging. You really need to have already built that foundation. And if you build that foundation, then you could have a heart attack. So here we go. So this is what a clean artery looks like on the left. On the left, you see, like the day somebody was born, like you're a kid, you see that little lining that's there. It's literally like one layer thick of endothelial cells. So that one layer is just so fragile. If you really think about it, it's so darn fragile that you need to protect anything you eat gets into your bloodstream, and it can damage that one layer. So what is this one on the right? This one on the right is an artery that's 99% clogged. Just that pinhole right there is allowing blood to flow through. Just that little dinky pinhole. So people look at this and they say, oh, this must be like how heart attacks happen, right? No, actually heart attacks don't happen this way. Heart attacks don't happen from blockages slowly getting worse to 80% and 90% and then 99%. So hold on one second. I have some people messaging me that they're not getting the video feed well. So let me see if I can figure this out here. I think I have it going. Initially, I tried to do this through a pre-published video, but then it didn't seem to work out. So therefore, doing it through a second one. So give me 1 second. Let's see. Now, it looks like it's working well here. So please comment in the comment section for me if you guys aren't seeing the video feed. So I have some people telling me they're not seeing the video feed. I think it should be going through okay. So comment, tell me if you guys can see it. Or if you can't see it, I'd appreciate that feedback. So you guys can see it? You guys got it? Okay, good. All right. Thank goodness, because this is my first time doing it. And again, I was concerned I might be off a little bit. All right, here we go. So the heart attacks don't happen from these 99% blockages. So here is the important thing to realize is that if you only have a 30 or 40% blockage, that can suddenly rupture and suddenly trigger a heart attack. So therefore, you might be fine one day, and then suddenly you clot that 30 to 40% blockage and trigger that heart attack. So actually 85% of heart attacks happen from blockages that are just 30, 40, 50%. Nothing, so you'd have no symptoms, and then boom, suddenly it would trigger that heart attack. So, okay, oh, thank you, Judy. So Judy said the original link. Yeah, so I tried to get into the original link and go live, and it wasn't letting me, so I started a separate feed, which looked like, to me, it linked together with the original link, but hopefully people aren't sitting there waiting in the other room. So thanks, Judy, for reposting that. Hopefully people have got on board here. So, all right. Hopefully in the future this won't happen again. I knew there might be some glitches the first time doing Facebook Live here, but we'll try to work this out in the future. So anyways, so let's think about this. Let's think about a lifestyle medicine approach using stents versus bypass surgery versus a lifestyle medicine approach. So we do 1.2 million elective stents every year. 1% mortality, meaning 1% of people die from those procedures. That's 12,000 deaths. Coronary stents, we do 1.12 million stents as well, right? When we do those stents, I mean, you get 4% heart attack. So 1.2 million stents, 4% heart attack. So that's 48,000 heart attacks we cause. During bypass surgery, we do 500,000 bypass surgeries every year. 3% of people die. That's 15,000 deaths that we cause. Doing bypass surgery, again, 500,000 of them, 3% of people have strokes. That's 15,000 strokes, right? That's a lot of deaths, a lot of heart attacks, and a lot of strokes as a complication of our procedures. Lifestyle medicine and a plant-based diet, here are the complications. There's no complication as a result of using a plant-based diet. It doesn't cause heart attacks. It doesn't cause strokes. And it's much cheaper. It makes so much sense. But of course, putting in stents and doing bypass surgeries makes so much money. So we need to protect the endothelium at all costs. At all costs, we don't want any damage to be done to our endothelium. That's the key, right? So this lining here, if we damage it and our blood cholesterol levels are high, you start building up this clogging. So here's the analogy that I like to use for this. Think of our endothelium as literally being on fire. There's a flame, and we're inflaming our arteries. Inflammation, think of that word, inflammation. It's on fire, right? So anytime you eat something, you smoke a cigarette, you eat something unhealthy, you're damaging that single cell lining right here. You're damaging it and causing it to be on fire. So what pours gas on that fire, right? If you do something unhealthy, it's like you're pouring gas on that fire and you're fueling the flame. What kind of things do that? Well, eating animal products, eating oil of any kind, those bad refined carbohydrates, even caffeine causes some degree of endothelial dysfunction. Saturated fat, of course, tobacco and smoke and other exposures. Literally, why would you ever want to pour gas on that fire, fueling that flame? You wouldn't want to. So what pours water on that flame? That's what you want to do. You want water only, right? So fruits and vegetables, beans, lentils, whole grains, herbs and spices is 100,000 edible plant species that you could eat that is literally pouring water on there, right? So we have this messed up concept in medicine where we think that we need a stent, we need a bypass surgery, we need a pill, a supplement. The human body is so messed up, it clogs its arteries, it's not designed well. That is completely the wrong mindset. The human body wants to be healthy. The default state of the human body is health. So all we really have to do is remove the thing that's causing the harm. So if you remove the thing that's pouring the gas on the fire, and the body heals up and you can put out that fire, right? So stop causing damage and the body heals up. No different than if somebody cuts their hand with a knife, just slices it with a knife. And if you do nothing, your body will stop the bleeding, form a scab, and heal it over within a couple weeks or so. However, if you keep cutting yourself with that knife 3 times a day, breakfast, lunch, and dinner, you never give the body the chance to heal up. And that's the issue. You need to give the body the chance. And so our endothelium on the inside is no different than our skin on the outside, but we just never give our endothelium the chance to heal up because right when breakfast, the damage from breakfast is wearing off, boom, here comes lunch or here comes that cigarette. So we need to just pour only water on that fire to put out that inflammation and the body will heal itself. That's really what we need. So here's one test that we can do to measure endothelial function, the brachial artery tourniquet test, where they actually inflate the blood pressure cuff for 5 minutes, and then they deflate it and see, boom, how much can your artery expand and relax? If you eat something unhealthy, it can hardly relax. If you damage your endothelium, eat animal product, oil, or whatever. However, eating a plant-based meal, and then you do this test, boom, the artery dilates quite a bit. It only takes one meal. Look at this. One meal. The blood on the left is a good, clean meal, low in fat, a plant-based meal. The blood on the right is drawn right after somebody had a fatty meal. So all that fat is flowing through the arteries, damaging the endothelium, making it so it can't relax, decreasing the production of nitric oxide. We don't really want that. So risk factors to clog your arteries. Which risk factor is absolutely needed? Only high cholesterol. Meaning, yeah, there's other things like cigarette smoking, diabetes, physical activity, and stress. But if your blood cholesterol levels are crazy low, it doesn't matter. You could be an obese diabetic couch potato who smokes cigarettes and you won't clog your arteries. It's crazy to think that. So you need to get your cholesterol levels crazy low. Very well described in this paper in the Journal of American College of Cardiology, just published, I believe, in August of this year, so just 4 months ago, where they looked at this. It looks a little bit complicated, but look over here in the lower left. That's when you're 0 years old and you're getting older going across here. And this is the cumulative exposure to LDL cholesterol, bad cholesterol. Remember, LDL cholesterol is lousy or lethal. You want that one to be low. So starting when you're a kid, you start getting higher points on this cumulative exposure. We call this plaque years. Instead of for smoking, we have something called PAC years. This is plaque years. And so this cumulative exposure to LDL cholesterol. So if somebody's LDL was 125 from the day they were born, by the time they hit the age of 40, they have a 1% risk of having had a heart attack. So what if the average American is somewhere around here, 125? What if your LDL was 150 or 170? Then your number is going to go up and up and up, and your risk, your cumulative risk of a heart attack is going to go up and up and up. So the sooner you get your LDL cholesterol as low as you possibly can, the better you're going to be. So you really want to start, even have your kids get their cholesterol checked, have them eat clean, keep your LDL under 70 and your total under 150. That's really where the zero event rate happens, but you want to do it as early in life as possible, because if you wait till you're 70 and you already have had 8,750 plaque years accumulated, that's your risk of heart attack, right? So you want to start as soon as you can to keep this number as low as you can. So what is normal LDL levels? Well, really, it should be between 50 and 70. That's where we should be at, because levels of healthy neonates and primates are around 30 to 70. So that's really where we should be at. And if you look at all these huge clinical trials, each one of these dots is thousands of patients in a clinical trial. And this is for people in what we call primary prevention. They've not had a heart attack yet. If you take this line and you look, where do zero heart attack events rates occur? An LDL of 55. That's where zero occurs, right? How about somebody who's already had a heart attack? You do the same thing. Each dot is a huge clinical trial with thousands of patients. You draw a line, where do zero events occur once you've already had a heart attack or a stroke or a clog? An LDL of 30, if you extrapolate that down. Now, that's not a perfect way, but it's a good way to give us an idea that we really need to get our LDLs at least into the 50, below 70 for sure, maybe around 50. Once you've already had an event, maybe around 30 is what's better. And so here's a crazy statement from the National Cholesterol Education Program. They said, despite the low risk of heart disease accompanying LDL cholesterol levels that are optimal, and they said less than 100 again, we want lower than that, the intensity of clinical intervention required to achieve such levels for everyone in the population would financially overload the healthcare system. Drug usage would rise enormously. They are assuming that the only way to lower cholesterol numbers is drug usage. No, whole food plant-based diet, right? And so what does Dr. Esselstyn say about it? The reason given for not advocating lower levels was that it might frustrate the public, who would have difficulty maintaining a lower level. It seems to Dr. Esselstyn, and I completely agree, that the public's greatest frustration would actually come from not being informed as to what the optimal diet and the optimal cholesterol levels truly would be. That's where the frustration should come in. So if you have high blood cholesterol levels, which is super important to prevent or reverse heart disease, you need to get all the dietary cholesterol out, which is you need to be on a plant-based diet. You need your saturated fats to be really, really low. 95% of saturated fats come from animal-based foods, right? And you want your trans fats to be as low as you possibly can. So how do you do that? Whole food, plant-based diet. It makes sense. Halts and reverses heart disease. Nathan Pritikin was the first founder of this whole lifestyle medicine concept, and he had severe heart disease himself. He said, I want my autopsy to be published when I die. And what did it show? Published in the New England Journal of Medicine. The near absence of atherosclerosis and its complete absence of its effects were remarkable in this guy who already had heart disease. That inspired Dean Ornish to do some phenomenal research as well, where he actually took patients and randomized them to lifestyle medicine, including plant-based diets versus a control group. And what did he find? He found, published in 1990, a long time ago, 28 years ago, in Lancet, one of the most prestigious medical journals, that blockages decreased from 61.1% down to 55.8% if they had the plant-based diet and lifestyle program, but it progressed. It got worse, 61.7% to 64.4% in the control group. And this was at 1 year. And so long-term follow-up, they actually did a 5-year follow-up, which showed even more regression after 5 years. So this is going in and doing angiograms, randomized, blinded, controlled, phenomenal way of doing it. Very, very good study. And so this essentially showed the cure for heart disease. Yet nothing happened. Of course, there's no money in this, right? There's no huge corporate budget pushing this forward. He also included how you manage stress, love and support, and how much you move, exercise, which is all great. That makes a lot of sense. However, Dr. Esselstyn will say his was only diet only, right? So this is Caldwell Esselstyn, great story. Watch Forks Over Knives, you'll hear his story, phenomenal man. He did an initial series of 22 patients with severe coronary disease, about to die. And he actually had regression of disease as well. So the mean blockage dropped from 53.4% down to 46% in a relatively short time period. Now remember, it took decades for this plaque to build up. It's gonna take decades for it to go away, right? So you can't expect it to go away immediately. But among the control group who didn't participate, they had a huge number of events. So this is one of the ways where was deemed a cure for heart disease, a plant-based diet. Now he did diet alone. So Ornish itself actually had the exercise and the wellness and that other stuff. However, Esselstyn was diet only. Therefore, there's a lot more emphasis put on the diet part of it than the overall wellness component. So he followed this up with another series. Granted, there wasn't it wasn't randomized, there wasn't a great control group, but it was there. There was 198 patients, and they looked at the adherence rate, and 89% were adherent. Those people had a 0.6% rate of heart attack, stroke, or death. But 21 people weren't adherent. They had a 62% event rate, and this is about a 4-year follow-up. Phenomenal data. And so, of course, the conclusion is that plant-based nutrition has a potential for a huge effect on the cardiovascular disease epidemic. We know that. So what types of reversal are there, though? This is an interesting thing that a lot of people don't talk about. Soft plaque, that's mostly cholesterol, can actually regress. Those are the ones where we see the blockages going down. But once somebody's got calcium already scarred in there, it's almost like hard, calcium's like rock, right? It's hard scar tissue. That type of plaque doesn't necessarily reverse itself or regress. However, the inflammation subsides dramatically, and you actually open up the microvasculature, the small arteries. So even if the calcified clogging, say it's 80 or 90%, remains 80 or 90% after 5 years on a plant-based diet, since the small arteries open up, perfusion studies, stress test that we do, they improve dramatically because they can improve within 3 weeks. Wait a second, how could a stress test that showed a major area of the heart not getting enough blood flow suddenly nearly normalize within 3 weeks? It's because of the microvasculature, the very teeny tiny arteries opening up, restoring blood flow, not because a 90% blockage went down to 50% in 3 weeks. That doesn't happen. So there's actually 3 different types of heart disease reversal. So when you are on an Esselstyn program, you avoid all foods that cause endothelial dysfunction, like we went over. Anything that increases blood cholesterol levels, we want a crazy low, and you want to increase foods that help you produce natural nitric oxide. Keep the diet very low in fat, about 8 to 12% of calories. No oil, no animal products, no nuts, nut butters, coconuts, or seeds. The only exception is 1 to 2 tablespoons of ground flax seeds, fine to get your omegas in there. Olives, avocado, tofu, and soy need to be out. They're all too high in fat. A light tofu on occasion's all right. No processed sugars. Caffeine's out. Salt in very small amounts. It must be less than the number of calories. So if you're eating 2,000 calories a day, less than 2,000 milligrams of sodium. And don't eat smoothies. Chew your food. You need those digestive enzymes. So things you can eat, of course, fruits. Don't do too much on the dried fruit. They're very calorie dense, but tons of fruits, vegetables, whole grains, herbs and spices. Drink mostly water. You can go for a little bit of tea and stuff or decaffeinated coffee. And the ground flax and chia seeds in small quantities are fine. But you want to also focus on these nitrate-rich vegetables, which actually help to naturally increase your own nitric oxide production. So we have beets, Swiss chard, oak leaf lettuce, and the number here is the amount of nitrate milligrams per 100 grams that you could actually get. Basil, spring greens, butterleaf lettuce, cilantro, rhubarb, and arugula called rocket lettuce. Look at how that towers over everything else. Now everybody's saying, wait a second, I thought beets were huge in nitrates. The runners do it a lot. Well, they're actually 10th on the list. And then other people say, I thought kale was like the craziest healthy thing. Well, look at this. So kale is only 27 on the left. And look on the right, beet juice, which a lot of runners use, is still only 279. We like to avoid juice, though. We want to eat food in its whole natural form. So try to avoid the juice. So here is what Dr. Esselstyn lists. Have 6 servings a day is what he wants. When somebody's severely clogged, they just had their heart attack or their diagnosis, for a few weeks, he wants you to like really, really, really bathe your endothelium in nitrates. Bok choy, Swiss chard, kale, collard greens, beet greens, mustard greens, turnip greens, arugula, napa cabbage, Brussels sprouts, broccoli, cauliflower, cilantro, parsley, spinach, and basil. And Dr. Esselstyn says it way better than I do, but hey, I gave it a shot there. So, so that's really what you need to eat. He says 6 servings a day. Boil it for about 5 minutes or so, and put some balsamic vinegar on there. The acetic acid helps to activate some of the enzymatic process to get the nitrates going. So that's what he recommends. So, sounds crazy, right? Well, some people think a plant-based diet like this is extreme, but 500,000 people a year will get their chest opened up and get this open heart bypass surgery with this vein taken out of their leg and sewed in to bypass the clogging, which does nothing to treat the cause of a person's illness. I think that's extreme, and so does Dr. Esselstyn, and so do all the plant-based lifestyle medicine-oriented people. We need to prevent and reverse heart disease. So we're doing so. PBNM is a nonprofit organization that I'm very, very excited to be a part of, pbnm.org. We're doing immersion. So here's an immersion that we held where we had people come in and we talked to them about whole food plant-based diets, heart disease reversal. We got wonderful feedback, and we plan on doing these immersions and hopefully spreading this all throughout the country, making it available at a relatively low cost for as many people as we can so that we can educate the public, because the only way to make a difference is going to be a grassroots movement of physicians and dedicated community members working together, which is what we want to do at pbnm.org. Nonprofit organization spreading nationally like wildfire, like crazy, because so many physicians want to practice lifestyle medicine, but it's just not possible within their healthcare system because it's not really a great moneymaker, So really, we have put together this great organization with a mission to organize a combined effort of healthcare providers and community members to promote lifestyle medicine changes to improve the health of America. And we want to get rid of the current epidemic of chronic disease using lifestyle medicine and whole food plant-based nutrition. So that's really what our organization is doing. We have more than a dozen physicians in the Chicago area, and Tampa, led by Dr. Kaushik Reddy, is going strong with many physicians. And we're hoping every city that we can just stand up, come together as a community and say, we need to not only support people trying to make this change, but become activists and get out into the community and spread the word and help support other people. Cooking classes, group meetings, immersions, whatever we can do to help spread this word is so darn important. So, the last thing I'd like to just mention before we get into kind of question and answer stuff is we are having a 5K event, Spring into Health, April 27th, 2019. It's going to be a 5K walk and run. The first one's in Chicago. So if you're not from Chicago, sorry, and hopefully eventually we're going to get this throughout the nation. But it's going to be in Bussey Woods and Elk Grove Village. And we are really going to try to make this a huge, huge, exciting event that everybody can benefit from. So physicians are going to be doing this with the participants. Dr. Joel Kahn is going to be there. He's going to be our keynote speaker. I will be there myself, Dr. Ashwani Garg. We already have 14 physicians and nurse practitioners that are plant-based signed up to do this event. So check out springintohealth.org. Not only that, you get a meal afterwards, presentations from physicians. Katie Simons is a plant-based chef. She's agreed to do a cooking demonstration for us. Food tastings from plant-based restaurants, stretches and massages and stuff, all to support this message of lifestyle medicine and plant-based nutrition. So we really, really, really are working hard to try to get this done. So springintohealth.org. So that's kind of the end of the presentation that I have for PowerPoint. So this is where now I'd like to open up to question and answer. And so I apologize. I don't know how it worked with the whole Facebook Live my first time doing this. I had tried to queue a presentation to promote it in advance. However, when I went in to go to try to start that live feed, it didn't let me. It didn't let me start the live feed. So for the sake of time and anybody else that was there, I started the Facebook Live feed separately. And so anybody who follows my page certainly should have been notified straight out that I was live. I hope nobody is sitting in that other room. If there is another room that exists somewhere, hopefully somehow it all kind of came together. So if there's any questions, I guess we can go ahead and just kind of type them through into the chat box and go from there. And if there's not, because not too many people came through, I know it's a hard time of day to get in and to watch a live type of an event, then certainly people can continue to comment and ask questions even after this session is done, and I'll do my best to respond to every single question, because I'd like to support the community in any way possible. So let's see if I could check and see how many people are in here, if I could look at the chat box. So I see, let's see, kicking up the arugula. Good. Yeah, arugula is certainly is the best one. It's got a little bit of a bite to it, but it certainly is pretty powerful. Oh, one of the other things I want to mention too, I forgot to mention, if anybody wants to hear my story a little bit more, I mentioned at the beginning, it was published on Forks Over Knives. So you could read it here, Watching Forks Over Knives Change This Doctor's Life and Career. So yeah, unfortunately too, with this whole Facebook Live thing, I can't go back and forth between sharing my screen. Once you start sharing the screen, all you get is my screen share. So I can't go back and forth, which is an unfortunate feature. So we'll have to figure that out in the future. So any other questions? Let's see. So interesting. So somebody said, I have a new stent. What happens is that on a whole food plant-based diet? Well, so the stent's can stay there. Once you have a stent in your coronary arteries, for those of you who don't know, a stent is like a scaffolding that kind of holds up the artery. It props open the blockage. It literally takes the blockage and shoves it off to the side. And the stent is a metal scaffolding that stays in there forever. That's going to stay there, no question about it. The best thing that a whole food plant-based diet is going to do is prevent progression of new clogs somewhere else, because a stent will only occupy a teeny portion of your artery. The rest of it is still, prone to clogging further down the road. But I had a funny question that somebody once asked me. It was, Doc, if you get this heart disease reversal, where does it go? Where does the clogging, the cholesterol, where does it actually go? And I said, let me think about that. And so we get something that goes on in our body called reverse cholesterol transport. The HDL, healthy cholesterol, job is to go into arteries and suck up cholesterol from the arteries and bring it back and to the liver, where it gets processed. It gets excreted out into the bile, and then the bile goes into your intestines, and a lot of it that doesn't get reabsorbed, where does it go? Well, you poop it out. And so then I thought, well, that's pretty cool, because if you really think about it, as you're reversing your heart disease, you're pooping it out. So I'm like, maybe I should write a blog article or something called "Poop Out Your Heart Disease," and that could catch so good headlines. But that's kind of potentially where the clogging goes, is it just goes right down the toilet bowl. I mean, very small amount. Of course, I'm sure you can't look down there and say, oh, there's a cholesterol plaque that just came out. Oh, thank goodness, I'm reversing my heart disease. No, not quite like that. But it's just kind of a funny concept that that when you do it that way, it actually the reverse cholesterol transport goes into your liver, into the bile, and it actually really goes out that way. So I had a question about omega-3s from flax, chia, walnuts, etc. Well, that's great. So in regards to cardiovascular disease, first of all, omega-3s really don't have anything to do with heart disease or clogging of arteries. It's been pretty well shown in clinical research that taking fish oil does not reduce cardiovascular events. People who are low on omega-3s don't necessarily have a higher risk of cardiovascular disease. So the data is pretty clear on that. There's been multiple different meta-analysis and studies showing that. So omega-3s and heart health, just don't even think about it. The only reason to be concerned about omega-3s is brain health, and that's it. And so, you get short chain omega-3s, which come from chia seeds, flax seeds, hemp seeds, walnuts. And then you get long chain omega-3. So the short chain ones are called ALA. Longer chains are the DHA omega-3s. The DHA, frequently people think about getting them from fish, but you could also get them from algae, which is the more plant-based source, because where do fish get it from? They get it from algae, right? However, eating fish to get omega-3s, to get your long chain DHA, that's not good for you. You get cholesterol, you get saturated fat, you get other things you don't want. I tell people, eating fish to get omega-3s is like eating a Snickers bar to get peanuts, right? Yeah, you get peanuts from a Snickers bar, but you get all this other stuff that you don't want in that Snickers bar as well. So don't eat fish to get omega-3s. If you really want these long chains for your brain health, not heart health, brain health, then you can take an algae-based DHA supplement, much more important in pregnancy and breastfeeding. If you don't want to take an algae-based DHA supplement, though, and you're not pregnant or breastfeeding, just get a DHA level checked. Because some people, a percentage of people, a pretty good percent, can actually take those short chain omega-3s from the chia seeds, flax seeds, hemp seeds, and convert enough of those to the longer chain yourself. But some people can't. And how do you know if you're a person who can or can't? Got to check your DHA levels, or just simply just take the algae-based DHA. So one or the other, either get your levels checked to see if you're somebody who can convert the ALA short chain omega-3s from the flax, hemp, chia to the longer chain ones, or get your DHA levels checked. And remember, this is for brain health only. So that's a good question. That's a good question. A question about the lipoprotein a biomarker. Do you have any information on lipoprotein a for heart disease? Does a diet over time decrease this marker? Absolutely. So first of all, lipoprotein a is about 20% of people have this type of lipoprotein, and it is a very, very what we call atherogenic, artery clogging type of cholesterol lipoprotein, lipoprotein a. Everybody should get it checked at one point. You don't necessarily need to track it or monitor it if you don't want to. However, everybody should get it checked. And if you're high on it, that's an independent risk factor for clogging your arteries, independent of smoking or other blood cholesterol levels or whatever. So what can we do then? Say somebody's got a high lipoprotein a. Well, there are certain things that can lower it. Niacin is a drug that they use for years. They can lower lipoprotein a. We knew that, but even though niacin lowered the lipoprotein a, it didn't lower it enough to prevent artery clogging, to prevent heart attack, to prevent stroke. So why the heck would we do it if it's not preventing a heart attack or stroke or death? However, there was a good abstract that was published just recently, and hopefully the full paper will be published soon in a peer-reviewed journal, done by Baxter Montgomery in Texas, who's a plant-based cardiologist, has a phenomenal clinic there, actually showing, and I believe it was somewhere around an average of a 15% decrease in lipoprotein a on a plant-based diet. So patients were randomized to plant-based diets versus regular nutrition stuff, and they measured a bunch of different biomarkers, and lipoprotein a went down very significantly. Of course, with all of cholesterol, there's a lot of what we call individual variability. Some people go on a plant-based diet and their numbers just plummet. They go down so crazy low. About 30% of people are hyperresponders. About 50% of people get moderate improvements to the cholesterol numbers, and 20% don't get too much. It only is a small amount of benefit, but everybody, it goes down. So it's possible that with lipoprotein a, you might get the exact same type of a response that you're going to get some people whose lipoprotein a might dramatically drop. And some people, it might only moderately drop, and some people might only slightly drop. Who knows? I had to guess. That's what I would say. I wish there would be more published data on that. We'll kind of see how that goes. But so with lipoprotein a, everybody should get theirs checked. But we want our total cholesterol under 150, our LDL under 70. And even if your lipoprotein a is high, do everything you possibly can not to damage your endothelium. You don't want that endothelium to be damaged whatsoever if you can possibly avoid that, because it's certainly the most important risk factor for clogging of arteries is your blood cholesterol levels. However, say you're on a whole food plant-based diet and your LDL is still high, or your total cholesterol is still high, or lipoprotein a is still high, then it's even more critical and crucial for you to be sure you're not damaging your endothelium with animal products, oils, sugars, tobacco, or other exposures. Even things like living near a highway has been shown to increase the risk of heart attack and stroke. Isn't that crazy? So that's like exposure to all the exhaust and fumes and stuff like that can do it too, because you're getting endothelial damage from that. So So yeah, so do everything you possibly can. So thanks, welcome Bonnie. I'm glad you're listening and enjoying it all. And hopefully as we do more and more of these and I figure out more of the quirks with the whole Facebook Live technicality, we can have some really, really great discussions and get people's questions answered. Because again, I know a lot of people in the plant-based world, they live and breathe this stuff. So people read all the books, they might know a lot of these answers, but there's a lot of people who we really want to bring into this way of eating and this lifestyle. And those people, they need the support, they need the help. So hopefully this is going to be a good forum for people to just kind of call in and try to get their answers. So is this whole screen sharing thing working good? Can you guys see, did that work okay with the presentation, I hope? I don't know if the other room is somehow live, but I may actually have two Facebook Live things going on simultaneously. I'm not too sure. But I'm going to hang out here, ask some more questions in the chat that I see, and I'm going to see if I can look into into the other the group and see if I could find if something is going on over there. So let's see here. All right. Questions in the chat that I see, and I'm going to see if I can look into yeah, I actually have the live feed going up here on my own phone, so that's pretty cool. I can kind of see it going and doing it at the same time. So all right, great. I'm glad it's working here. So any other questions or thoughts, throw them out there. We could oh, here we go. Hey, Dr. Reyes, thanks for joining. Did you ever use statins, and at what point? So that's a great question. Statins actually, so what I was thinking about doing in February, Heart Month, is actually doing a bunch of these talks and focusing on lots of different topics like cholesterol management, blood pressure, and maybe repeat this whole heart disease prevention reversal thing in February, because I want to try to do this every week. But so we'll go into great detail about statins and drug therapy for lipids. And yeah, statins are very helpful. What I would say is we'd like to avoid them, obviously. They have their benefits, they have their risks, but there are going to be a certain percentage of people, again, that if they get on a 100% plant-based diet and they still don't get their numbers low enough, and they also agree that they don't mind taking a medication, they want to be crazy aggressive at lowering their cardiovascular disease risk, that's where a statin could come in. But let's take a step back for a second and think about statins. So a statin is a cholesterol medication, blocks the enzyme called HMG-CoA reductase in the liver in order to stop you from producing cholesterol, right? Lipitor, Zocor, Crestor, you may have heard of atorvastatin, simvastatin, pravastatin, lovastatin. These are the statins, right? So people who go on a whole food plant-based diet, the average person, if they get to their ideal body weight on a whole food plant-based diet, their total cholesterol should be around 150 and their LDL should be around 70. So the average person should not necessarily need a statin. However, again, you can have those outliers. I actually have a number of people who do. So I had one patient, younger guy, came to me, his LDL was 240. And he's like, oh, I've been told it's genetic. I'm only 30 years old. I'm really worried. And they always want to throw me on these statins, and I don't want a statin. So I talked to him, and he got motivated. He went on a whole food, plant-based, no oil diet. And just within a month, his LDL came down to about 150 from like 200. I forget what it was, 250 or 280. It was crazy high. It was close to 300. So he came down pretty quick, which is great. However, he's still 150. That's still kind of high. And as if you remember the slide that I showed before, that if you are over 125 for so many years, you still have a risk. And so he's like, okay, I'm happy at 150, and he didn't want any drugs, which is great. So here's the slide. So he had probably been high for many years, so his plaque years had probably accumulated a lot. So but this guy now is sitting around 150, right? So now what does he do? Well, what Dr. Esselstyn would say, although there's not a lot of good evidence to support this statement, he would say that as long as you're not damaging your endothelium, you're not smoking, you're not eating animal products, oil, sugar, refined carbohydrates, getting exposed to other secondhand smoke type things, you should be all right. You eat your nitrate-rich vegetables, keep your natural nitric oxide production up as much as you can, and even if your numbers are high, as long as you're doing everything you can to protect your endothelium, you'll be okay. Okay, that makes a lot of sense. Where's the data to support that? Unfortunately, the broccoli industry and the arugula industry isn't going to fund that study, right? So we don't really have that data. That does make sense. However, if that patient came to me and said, listen, I dropped my cholesterol dramatically in a whole food plant-based diet. I've been doing it for a year now. My LDL is still 150. And listen, my dad had a heart attack when he was 40. My dad's had a heart attack when he was 40. And he doesn't have lipoprotein little a or any of these other things. Yeah, I would say another approach that we could do is to, in addition to the whole food plant-based diet, not instead of, that's huge. In addition, we could use a statin and get your LDL, try to get it under 70 to be aggressive. Now, granted, that's a little bit more aggressive than what the guidelines would state. But still, if somebody wanted to be aggressive, they don't mind the medication, I would use it. However, one of the slides I don't have here in this PowerPoint talks about something that we call the absolute risk reduction of a statin. It's maybe 5% risk reduction of heart attack, stroke, and death within 5 years of a statin. 5% on an individual basis, 5% absolute risk reduction, maybe 20 to 30% relative risk if you understand those statistical terms. But the point is it's only a small benefit on an individual basis to prevent heart attack, stroke, and death within 5 years. Think about this. 50 million Americans take statins for cholesterol. Heart disease is still the #1 cause of death in America, right? So it's clear that a statin is not a cure for heart disease. We don't just want to throw everybody on statins, put statins in the water so people could eat Big Macs. That makes no sense whatsoever, right? However, on those people who are already whole food plant-based, no oil, at their ideal body weight, their LDL is still high, and they're willing and want to be aggressive, we could try some degree of a statin to get those numbers down lower. Long answer to your question, Dr. Reynes, but it's definitely a very good question. Oh, yeah. So the follow-up question is can you use CIMT to decide, carotid intimomedial thickness to decide? Well, you could do that, or you could use a calcium score. So CIMT is measuring the intima, the inner lining of the artery, of the carotid artery. And we know that if it thickens, that means plaque is building up. It's been used as a marker for risk, a marker for clogging of arteries. If you have it here, then you probably also have it in your heart as well, right? So that is one way that you could say, if you're borderline, the person's like, I don't know if I really want to do this. Okay, fine. You could use the carotid intimomedial thickness as a guide. Look, it's really thick. You should definitely do the statin. Or you do a calcium score. Look, and that's actually in the new guidelines that were just released, using calcium scoring as an adjuvant tool to decide do you put a patient on a statin or not. So we can use those calcium scores. However, remember, these are great things for a discussion point and to bring in with your patient. But what I would say is, in the aggressive world, the lower you get your LDL as soon as you can, the better you're going to be. And so it's really variable based on the patient's willingness to be aggressive. If they say, I want to be crazy aggressive, let's do it. Then obviously, why would you do the carotid or the calcium score? But if a person's resistant to the medication, you're trying to tell them, listen, I think you probably benefit, do a calcium score. And if the calcium score is high, or if the CIMT is thickened, then yeah, that might persuade you to push over to actually do to be more aggressive with the medications, in addition to the whole food plant-based diet. Never let